Quite simply, I'm a heart rhythm specialist. I'm an electrician of the heart. In cardiology, we have plumbers and electricians. I'm the electrician. I take care of any heart rhythm disorders, any fast heart rhythms, slow heart rhythms, or irregularity of the heart rhythm. Well, unfortunately, as we age, our heart ages and the electrical system within the heart can age. Our heart's been beating before the time we were even born. Common things that can happen over time is the wiring can get rusty, and sometimes patients end up needing a pacemaker. Atrial fibrillation is a rhythm that actually, in the majority of patients, appears to occur as time goes on. You get fibrosis, you get scarring, and unfortunately the heart starts to beat irregularly. And this can be a challenge to take care of. For the most part, the majority of patients who have atrial fibrillation are perhaps in their 60s, 70s, and 80s. And the majority of those patients actually have no idea that they're in atrial fibrillation. They pick it up incidentally during a physical exam, for instance. And these patients today can be managed with controlling their heart rate, making sure they don't have a stroke with potentially a blood thinner, and can be taken care of quite simply doing those two things. There's a sizable minority of patients who actually don't feel well in atrial fibrillation, and they clearly have symptoms, and they need something more than protecting themselves from a stroke or making sure the heart rate doesn't go too fast. And in symptomatic patients, first line of therapy is to try a drug to see if we can control their symptoms, control their atrial fibrillation. And when that fails, now we actually have technology where we can do catheter ablation techniques or some type of an ablation to take care of their atrial fibrillation. There are several ways of performing an ablation. In the early days of ablation, this involves surgical techniques where patients actually have to have their chest cracked open. In the last 30 years, we've been able to do minimally invasive procedures where we are able to thread a little wire through the vein up to the heart, locate these irritable areas, and destroy them with heat, sometimes freezing it. And that's pretty much what an ablation is. So we are the only group in the South Sound that performs ablations for atrial fibrillation. We've been doing it longer than anybody else in the area. We have a dedicated team. We have state-of-the-art technology to take care of atrial fibrillation. We do more atrial fibrillation ablations than a lot of other centers around here. We've been able to incorporate innovative techniques. We've cut down our radiation dose down to about 3% of what we were using 3 years ago. We have an excellent surgical team that we've been teaming up with and are planning to start performing hybrid atrial fibrillation ablations for patients that have more advanced disease. We're currently evaluating using freezing technology or cryoablation technology to see if we can help our patients get a better outcome. Multicare has been very generous in their support of taking care of our patients with atrial fibrillation.